Welcome back. This is Consumers Doctor on the behalf of the Foremost organization. This is a healthcare segment, folks. This is a healthcare segment. So Foremost organization's goal is to see everybody gets educated on general aspects of healthcare. We have been talking about personalized health insurance, so-called health insurance personalized, which is HIP, which is nothing but a deductible plan which qualifies you to put money aside to rainy day. This segment is basically for people who have personalized healthcare or along with the health HSA, Health Solutions Advantage rainy day fund. If you have a rainy day fund, these classes are meant for people. They're saving money off of their health. They're educating themselves. They know how to take care of themselves. Americans know how to handle their own health. I've been talking about different topics, and yesterday we spoke about health records. Today we're going to talk about hypertension. Let's talk about hypertension. I'm not, I want to educate myself because I'm like you guys. I'm a urologist, I'm a physician, but I can understand, I can explain maybe somewhat better to the average folks, but the way you do it, the way you take care of yourself, this is what it's all about, personalized healthcare. When you have a health insurance, it's personalized. You want to take care of your health. You want to do exercise, you want to have a good diet and a good night's sleep, mentally well, and not many bad habits, not many bad habits. So today's topic is hypertension. Yes, hypertension. When you go to, I was focusing on you if you have hypertension, how do you handle it? How do you, this is what I would do. This is what I am doing, because if I have a hypertension, I have a mild hypertension, but what is the hypertension? What is this is all about? Well, how does it affect your body? If you go to the Google, Google is a savior. If you go to the Google in your browser, put hypertension. That's all there is to it. And they'll give you, it says, it tells you what is hypertension? A condition in which force of blood, condition which forces of blood puts basically pressures on the wall. It pressures on the wall. There is let's talk. What does hypertension do? Hypertension can have serious complications if it's not handled well. If your hypertension, basically hypertension can make you age faster. I don't know how many folks know that, but it makes you age faster. So that's why you need to control your blood pressure. How do you control it? We'll talk about in general what is systolic, what is diastolic. Okay, whenever you have pressure on your walls, whenever your heart pumps, your heart is pumping. Whenever it's pumping, it creates a pressure on your wall. It's called systolic pressure. Whenever it's relaxing, when your blood draws into the heart, is diastolic. So when you have a blood is drawn into the heart, your blood pressure is lower. So there's a systolic blood pressure, there's a diastolic blood pressure, folks. Are you getting it? Whenever a heart pumps, the blood is rushed into the organs. That's a systolic. Whenever heart relaxes, so the blood is pulled back into the heart, the blood pressure drops in your system, in your vessels. So that's the diastolic. So everybody has a systolic and diastolic blood pressure. So that's a basic concept. we will talk about, when you say hypertension, what is the main cause of hypertension? What is the main cause? It's interesting. You can ask the same question, you'll get this answer. Most common cause of hypertension is obesity. Smoking. Smoking is also smoking, obesity, especially being overweight, diabetes, and having sedentary lifestyles with the lack of physical activity can raise your blood pressure. High salt can raise your blood pressure. Alcohol intake can raise your blood pressure. These are the things you have it on your mobile phone, man. You need to look into it. It's not like I'm being, this is what you guys need to do. What is it? What are the common causes of high blood pressure? Sedentary lifestyle, couch potatoes. They need to watch, man. You need to stop eating all this rubbish and need to focus on your physical activity. Lack of physical activity, high salt intake, alcohol intake, insufficient consumption of calcium can cause, even potassium low intake and magnesium low intake, deficiency of vitamin D, stress, aging, kidney disease, they all cause hypertension. So this is there at your fingertips, man. So what are the warning signs? These are the questions which everybody, what are the warning signs of hypertension? Getting to the basic, you guys need to take care of your body, take care of your blood pressure. If you do, as I said earlier, you need to be physically active. You need to watch your intake of potassium, magnesium, lower intake, and also, and certain things which I was that was something interests me, which low intake of calcium, potassium, magnesium cause hypertension. Vitamin D deficiency cause hypertension. Aging, stop aging. Stop getting old. I'm old already, so I'm telling youngsters and folks. So what are the warning signs of hypertension? What are the warning signs? Headaches. Very first thing is you get a headache. Nosebleeds. If the unexplained nosebleeds can tell you that, oh, your blood pressure is high. Fatigue, confusion. You're easily worn out, and at the end of the day, you don't know why you haven't done anything. Why? So that's also a warning sign. And sometimes vision problems. Vision problems. Chest pain could be from the hypertension. And sometimes if it affects your heart, it can have difficulty breathing. It can have irregular heart rate. You will have blood in the urine. There are a lot more symptoms can cause. There are a lot more symptoms. So what I see, there are a lot of things there are warning signs. You need to watch out because you can check. When you go to the Google, it is easy to find out exactly and what it does, what the hypertension does, and all that stuff. And I gave you the hypertension. I told you about the definition and main causes hypertension. I gave you that. What are the stages of hypertension? There are different stages, folks. Yes. Hypertension could be in 4 categories. One is pre-hypertension. Stage 1 is, which is pre-hypertension is mild. And stage 1 is moderate. Stage 2 is severe. So there are stages of hypertension: pre-hypertension, mild and moderate and severe. There are 4 stages. Okay, so the question is, what is the difference between high blood pressure and hypertension? These are interesting. High blood pressure is called hypertension. Blood pressure higher than normal is also called, basically you have a high blood pressure. What is the normal blood pressure should be? Ideally, the systolic should be 120, diastolic should be 80. When you have a under 80, doesn't mean it's bad, but main thing you need to look at, anything beyond 80 diastolic is considered as you have a high blood pressure. This most of the time, diastolic, you need to focus on the diastolic blood pressure. And nowadays, there are blood pressure cuffs are available, folks. They're not expensive. You can buy it, you can get it anywhere, and you can probably monitor yourself. How often you need to monitor? Well, whenever you feel like you're tired, fatigued, you have unnecessary headache, check your blood pressure. If you have, any unusual symptoms, you feel like, you're not doing well, go and check your blood pressure. That's as simple as that. And can a hypertension be cured? The question, can the hypertension be cured? Hypertension is a chronic disease. It can be controlled with medications. That's what it is. It can be controlled with medication, but it cannot be cured. Now you know it. You can't be cured, but it can be controlled. This I'm learning too, along with you guys. This is something which is I want you. This is where the beauty comes in. I'm not an internist. I'm not a general, but I know what I'm doing. I'm taking care of myself. You need to control your blood pressure, man. How do you control your blood pressure? We'll come to that. But, patient need to control your lifestyle modifications. As I mentioned earlier, your lifestyle modification, you can't be a couch potato. You need to be physically active. If you're not physically active, that can raise your blood pressure. Does stress cause hypertension? You bet. Can you feel high blood pressure? Most of the time, no, you don't feel high blood pressure. You may have some pounding feeling in your head or chest or lightheadedness, dizziness, but most of the time there are no symptoms out there, folks. What is the fastest way to cure high blood pressure naturally? That's a good one. What is the fastest way? Again, there are 10 lifestyle changes, man. This is what I want to get into. 10 lifestyle changes. Lose extra pounds. Lose extra pounds. Exercise regularly. Eat healthy diet. Reduce your salt in your diet. Limit amount of alcohol and drink. Quit smoking. Cut back on caffeine. And reduce your stress. Aren't they easy, folks? You can lower your blood pressure without going to seeing a doctor. Hey, I gave you some advice, at least that should help you. These are the 10 ways you can do without taking any medications, man. You're saving on your medicines. You're saving your doctor's visit. I gave you the tips. What fruit is the best for your blood pressure? Hey, you might ask me that question. Even I'm not aware. What is it? Citrus. fruits, grapefruit, oranges, lemons, lowers your blood pressure. Okay, a lot of people have a question. If I have, systolic blood pressure normally goes by your age. Suppose you're 44 or you're 50, 55. Even if you have 150 systolic, it's okay. The basic thing is, what it tells me is your systolic is 150 means your vessels, your blood vessels are getting hardening because of your age. So that's what it's telling you. Systolic gives you can go by your age. Suppose if your blood pressure, if you're in 50s, if your blood pressure is 180, that's high. Yes. So you should not be above 150 systolic. It goes by your age. Diastolic is the one which is very important. Diastolic. So what should I do if I have a blood pressure 140 over 90? Make sure firstly your blood pressure is below that. But if your blood pressure is 140 over 90, what should I do? You need to take medications. If consistently, in spite of all doing everything what I've been telling you, you still at if you have 140, you should take medication to lower, because the blood pressure affects organs everywhere. It affects your brain, it affects your heart, it affects your kidneys, it affects your sexual function, it affects everything. That's why blood pressure, maintaining a blood pressure is, and also, as I said earlier, your aging is faster. It damages your organs. It damages, your vital organs. So you don't want your blood pressure. If your blood pressure is high, it affects, if you have uncontrolled hypertension, your blood pressure, you can have a hemorrhage. You can have same thing with you can have age, not only you age faster, it damages your organs. That's why you need to take medications if you have 140 over 90. Aim at your weight, physical activity, foods with low salt, nutrition, and sodium diet, things like that. But you need to take medication. You need to take medication. A lot of people ask you a simple question. Drinking a lot of water lowers the blood pressure? Yes. When you drink water, basically what you're doing is you're lowering your salt. It will aid in lowering your blood pressure, yes. But I don't want to drink too much, because too much is not good for you. But you need to drink at least my recommendation, 8-ounce glasses. You need to have 8 a day. That's an average. You can, if you think you have a blood pressure, you can take a little more, but don't have too much water. That's also is not good for you, because that can cause other problems. So 8-ounce glasses. If you want to get 12-ounce glasses, if you want to lower your blood pressure, yes. What are the question people ask? What is considered as a stroke level high blood pressure? When does it cause stroke? People get stroke. As you age, when you have a severe blood pressure, it can lead to stroke. What is that severe? How much is it? The systolic has to be around over 80. When you have 180, and the bottom number has, diastolic has to be 120, it can not only damage your vessels, you can get stroke. Your systolic cannot be above 180. A diastolic, 90 can literally, you can hemorrhage into the brain. So you don't want that. Even when you have 90, you need to lower it down below 90, diastolic. So as I mentioned, by the age, can aspirin lower the blood pressure? Low dose aspirin seems to reduce the heart attacks, And it seems to lower the blood pressure, folks. Lower dose aspirin. What is low dose aspirin? 81 milligrams or 75 milligrams, whatever. It's recommended by, I think it's recommended American Heart Association, and they recommend aspirin, baby aspirin every day, especially if you're in 50s. And it also prevents to have less cancer, like colon cancer, things like that. Do bananas lower your blood pressure? According to the researchers, consumers receiving potassium-rich foods can lower the blood pressure. Bananas have rich in potassium. It's interesting. I will continue to talk about, we'll continue to talk about blood pressure for next few segments because we're learning a lot, right? Yes. Folks, I love you guys. This is fun. This is fun. I like it. I'm learning it with you. And I want to make it more interesting. If I can hear some comments. So I'll continue. Next few more segments, we'll talk about hypertension. Because this is the leading cause of chronic illness category. This is what we need to focus on. So if you do like this channel, subscribe, share, and hit that notification button. I love you guys, and we will continue to do this on a regular basis at 8 a.m. Pacific time, folks. I want to chat with you. On the behalf of foremost organizations, Consumer Doctor salutes you. We'll see you next time. Thanks again for joining.